Ladies and gentlemen, you are welcome to this presentation on depression. I'm Dr. Prosper Tettey Doe in the United Kingdom. The summary will be mild, moderate, and severe forms of depression. I also mention what somatic syndrome is, and then finally on treatments that is available. The mild form of depression, there are two or three symptoms usually, and these include mood, low mood, loss of interest in things that a person used to be interested in. There's low energy level, feeling easily tired, and the person is able to continue most activities. That is mild. The next level of severity is the moderate type of depression, where there are 4 or more symptoms and there's great difficulty in continuing ordinary activities. The next level after this is the severe form of depression, where there are several symptoms with loss of self-esteem, worthlessness, guilt, suicidal ideas, or even suicidal acts. And there's also somatic syndrome symptoms, which I'll expand on later. And the next level of severity is when it's severe with psychotic symptoms. And these psychotic symptoms include hallucinations, delusions, psychomotor retardation. Social activities become impossible in the severe form with psychotic symptoms. Now, somatic syndrome. Somatic syndrome is a state where the mood is usually worse in the morning, with decreased interest, with early morning waking and reduced appetite, or even weight loss, and there's psychomotor retardation or agitation. And there's also reduced emotional reactivity, and there's decreased libido. The etiology of depression, it occurs in families. When it occurs in families, then the risk is 8 times more likely to reoccur. There's also personality factors which may be associated. Others are stress, full life situations, childhood upbringing experiences, and sometimes physical. The treatment, which is guided by the National Institute of Clinical Excellence, that's the NICE, is what we call the step care approach. The first is primary care assessments, and the next is to categorize. If it's mild, then watchful waiting with self-help and computer CBT or cognitive behavior therapy. That is the mild form. And the third, which is the moderate or severe, in primary care, medication is prescribed, as well as psychological approach, and then social support, what we call the biopsychosocial approach. And in cases of treatment resistance, or whether if the patient there's psychotic features or the risk is significant, then the following medication and complex psychological approaches, as well as combination treatments, are recommended. And where there is a risk to life with severe self-neglect, then secondary care as inpatient is recommended with medication and combined treatments, and sometimes ECT, that's electroconvulsive therapy. Another form of depression called treatment-resistant depression. This treatment will need antidepressants plus CBT, sometimes lithium augmentation, and also venlafaxine, mirtazapine or mianserin augmentation, and also phenelzine can also be prescribed. So thank you very much for your attention, and I hope you have gained something. I wish you all the best in your studies and your practice. Bye for now. If you are interested in this, you can share it or you can subscribe also so that you receive future recordings like this. Subscription is free.